What's going on, folks? My name's Brandon. 4 weeks ago I had my TFCC and DRUJ in my wrist reconstructed. Mine was more severe. It wasn't just the sew your TFCC together and you're good to go. I damaged mine. I actually snapped off a piece of the bone off of my ulnar in my forearm, and then I also damaged all the ligaments and all that other good stuff. So they had to do what was called a Palmaris Graft, which is where they take a graft of a tendon from your same arm, and they use it like a rope, or almost like a bungee cord. They drill through each of the bones where you're having the instability. So like when you flex your arm and it jumps around a lot, or if there's like popping or whatever issue you're having in your wrist, it's usually because of instability. So they actually drill into each side of like the bones in your wrist and your arm, and they take the tendon and they run it through those holes, and then they anchor them in. So it's literally like a rubber band or like a rope holding your wrist, where it should be. So when you flex your forearm and your wrist, there's some stability. There's some resistance, like there should be. It's almost like wrapping, I guess, like rubber bands around your forearm and your wrist. It just gives you something to flex. Like there's no, popping or jumping. Mine, I broke when I was 15. I fell off of a bleacher. Backwards. I was showing off in front of some friends, and I fell off of a bleacher that was probably maybe 6 to 10 feet. I'm not really sure exactly, but it was high up enough that I landed funny on my wrist and just completely jacked it up. Didn't get it fixed back then. I just sort of threw on a brace and just ignored it. But the pain got so bad in the last few years that I sort of had to do something about it. It was time to get it done. Mine was so bad that my wrist and my forearm, like bones, would actually dislocate. So when I flexed my wrist, like you could see like the forearm pop out of where it should be. It was really gnarly. It's really, really bad. My surgeon was kind of excited to do mine because it was a rougher, I guess, case, or like just more of a challenge than usual. But yeah, just wanted to share a quick experience update on this for anybody who's thinking about getting it or who needs to get it. The amount of help that you're going to need is not limited. You don't overestimate your ability to be okay. Especially the first week after your surgery, you're going to need help. You're going to need someone to stay with you or check on you at least daily. I guess I'm a tough guy ahead. I thought I'd be fine on my own, but as soon as you wake up out of surgery, you pretty much need help. Like you wake up with your arm in a sling on your chest like that, and your arm's completely numb. They do what's called a nerve block, so you don't feel like any of the pain or the incisions when you wake up. The idea is that it sort of gives you a head start on your healing, and so you're not screaming when you wake up. I learned why. Because the next morning, after the nerve block wore off, I was in agony. Muscle spasms were terrible. They give you pain meds, but it's just, the first few days are really, really rough. I still have some pain, but the first, I'd say 3 days were really, 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 really challenging. But your arm feels like a big old block of rubber, like when you first wake up, like with that nerve block. But you'll wish you had it longer after you start to feel that, that pain. But things like making yourself a sandwich, making yourself coffee, playing video games, typing, taking your dog outside, driving, um, making dinner later on, you getting a shower, getting dressed, it's a freaking nightmare, man. It's like you don't realize how much you need your arms, man, like your hands, your arms, whatever you want to call it. You don't think about it until it's not there anymore. And thankfully, my mom and my ex-girlfriend helped me out, and they sort of took shifts with staying with me to help me out, because pain management was an issue with me. It was really, really difficult. I usually have a high pain tolerance, but this was very, very, very rough. It's about week 4 now. I went to the hand therapist after my post-op. I went to the surgeon. They checked the incisions. They were all good to go. And then I went to the hand therapist, where they make you a custom splint, which is like a hard, it's like a white plastic sort of like material that they shape up. They put it in like this hot like water to soften it, and then they wrap it around your arm, and they cut it and shape it and all that, and then they it's supposed to be better because it's custom to you. It was okay at first, but then I guess about a week and a half in, it became hard to wear because it was shifted around a lot. I guess that's because your arm shrinks in size, you lose muscle mass, and then it's just harder to kind of use that. They say that you can bring it back and have it like reshaped or refitted, but for now I've just been using the one that they gave me at the surgeon's office. It still does the job. So the back part of it is to stop your wrist from being able to flex, so that they don't want you to rotate your forearm or your wrist at all, or they don't want you to rotate your elbow, thus rotating your forearm, thus messing with your wrist. So you have to basically, they want you to completely stop your like your wrist or your forearm from flexing at all, because all that will lead to flexing your wrist, and that can mess up your surgical site or your healing. It's just something to keep in mind. But yeah, I mean, I just wanted to share a quick experience update on this, because it's been a challenge. It's starting to be more of a challenge, because when you have anxiety, depression, mental health things, it's hard enough when you have all your limbs, but then when you don't have, you used to have an arm or a leg, and you're completely sitting on your butt, and you can't do anything that you enjoy. You can't go out where you want to go. It's a challenge. So anyone who has mental health issues, or they don't have support in their life as far as someone that can come and help them out, seriously consider what your approach is on this. Whether you can go stay with a friend for a week or two that will like watch over you, or maybe you can get your insurance to pay for someone to come help you out, or you just have to wait until it's a better time. Unfortunately, not everyone is as lucky as like others when it comes to family and friends. And then also your mental health, like I said, just make sure you have that on lock, and that you're, if you're not seeing a therapist or a counselor regularly, or you might want to let them know what you're about to go through, and that you might need some extra support through your healing, because it is a challenge. Everyone's different, but I think at the core, as humans, we're all pretty much similar in that regard, that once you sit for so long, your head sort of starts to run away from you. So I've been trying to push it a little bit too fast, too soon. I think I aggravated my wrist here and there just by trying to get up and do stuff around the house, or go out here and there, things like that. And then I end up paying for it. So I have decided, as of today, I just need to sit my freaking butt down and just bite the bullet and just rest. I just need to sit back, relax, and let myself heal up, because I keep on setting myself back by trying to just still get back into the groove of things, but it's just not time yet. So I start therapy next Friday. You know, that starts twice a week, and that's going to be for 2 to 3 months, and see where it goes from there. But you know, I definitely underestimated the recovery on this, the pain, the lack of independence that you have, mental health impact, everything. I mean, it's I just hope that someone sees this who maybe you didn't think about all these things. Like, maybe it'll help you in some way. It's like, you know, I would recommend that you pre-plan. Start practicing using just your hand that you're going to have after surgery to do things around the house. Like, you know, figure out how you're going to do like your maybe if you're a coffee drinker like me, pick up some instant coffee so you can make it easily in the morning. Mental health stuff, like I said, set up something with your therapist or counselor or whoever to let them know that you're going to go through something and you might need some support. Or, you know, reach out to family and friends, let them know that you're going to need help, you know, that week or whatever. As far as like dinner goes, maybe pre-cook a bunch of meals and stick them in the freezer, or figure out like a meal delivery service, which is what I usually do. You know, so you don't got to worry about having to like mess around like in the kitchen and jumble around and make dinner and all that stuff. You just throw your dinner in the microwave and you're good to go. You know, think about all these things. You know, you also might want to have things on hand that you're going to need, like a large ice pack. Smaller ice packs don't really do anything at all, and you want one that's flat and flexible. They have them on Amazon. They're very, very thin and they're flexible. The one I got is actually large enough that I can wrap it around my entire arm, which is nice. So you can get like full coverage with the with the ice on your arm. So that I would recommend you getting like a large ice pack. Get one of those covers so you can shower. You can use trash bags and all that stuff, but Amazon sells something specifically for that would probably make things easier. It's just like a reusable bag that is made for this. Like, it's made for showering. Get a bunch of snacks on hand that you like, maybe some books, line up all your audio books that you like, or movies, any games on your phone that you can play with one hand. Small stuff like that would probably make your life a lot easier. Yeah, I mean, those are all things I thought about once I got there. It's like, I guess, poor planning and or ADHD. Probably more poor planning. I don't like blaming, I have ADHD or I have this or that. I just went in blind and thought I would be okay, but I had to quickly adapt. So I'm hoping that this will save someone else from having the not issue I did, but make it smoother sailing for anyone else who watches this. If you have any questions about the surgery or anything like that, I'll respond as soon as I can, and I hope you guys are well. Hope your surgery goes well if you plan on having it, and you guys be safe. Thanks for watching.